Thank you. It's so exciting to see everybody joining us today. I'm more than excited to have the role of introducing today's workshop. I guess it's a principle familiar to the world of improvement that the process that we use has a big impact on the outcome. And the process that's led up to today gives me just so much positive anticipation and optimism, not just about the quality of the resources that we're going to be learning about today, but the lasting and large-scale contribution that I think this can have in the health sector. Rob is going to say more about how this work was developed in a minute, but I guess I wanted to start with a few reflections on the principles underpinning this work. To me, this represents the power of our improvement movement, the power of the Q community, bringing together knowledge and expertise at scale in service of a shared purpose. The programme that's launching today builds on the success of the Quality Coach Development Programme. So that's a programme that was developed with support from Q Exchange, as indeed the programme is that you'll be hearing about today. The concept of kind of QI coaching from the initial programme, that I guess in itself represents a creative approach to decentralising improvement support, like spreading agency for change through organisations at a scale that is difficult with other models. But we know that to coach improvement well, and therefore to develop people to become coaches, calls for expertise beyond what our individual local organisations often have easy access to. So, this isn't just about conventional improvement methods, but coaching skills, human factors, group dynamics, behaviour change, a whole range of disciplines. So I guess when we spot a gap in development support for people who are on this journey, it would be easy to kind of get heads down and see what you can be doing or what you might buy off the shelf. But I guess I'm really pleased that the team behind the original programme decided instead to think about how we could collaborate. They bid for funding through Q and won support from the Q community to develop this collaboratively. That led to dozens of people working together over 4 years to iterate and test the original programme. The outcome was a shared resource that helps everyone save time and benefit from our collective expertise. And that kind of pooling of effort means that it's easier to do this kind of work properly. So to really tap into and build on the diverse knowledge that exists in Q across the sector. And then by using a Creative Commons license that's like open, that allows you to adapt the programme, make things personal to you and your context, that allows us to recognise that when we develop this from within the system, we're often best placed to judge like what can be consistent and how to adapt to different contexts. Making these resources free via the Q Community website and with NHS Elect connecting those, using them over time to help each other kind of implement them well. I think we're building improvement capability and capacity at greater pace and scale than would have been possible if we were working alone in our separate silos. So building on the success of the Quality Coach Development Programme, the team were successful in securing further support and funding to develop this programme that's launching today. The Collaborative QI Practitioner Programme was generated through that same strong collaboration across the UK and Ireland. It brings that expertise and collaborative energy to bear on the newer frontiers of improvement, where we need to work across system boundaries. So, collaborative in content and process. We know the health sector is hurting. The financial, the operational pressures that we'll all be familiar with means that we really have to make the most of the skills and expertise that we've got available. This programme, it's pragmatic, it supports staff to identify and act on opportunities for improvement within those constraints. And in the process, it values the NHS most precious resource, the spirit and energy of the staff who work in the sector. I really believe that, like equipping people with the skills and support to address the problems that they see around them, that's really critical if we're to sustain morale and energy as well as creating solutions that actually work. developing people in a way that recognises and cultivates the relational as well as the technical aspects of effective improvement is so important if we're to more consistently succeed in, and dare I say, enjoy the work of change. Having effective collaborative relationships in ways that acknowledge the complexity of human systems, that also feels really important to joy in work as well as delivering personalised care. When we're working in health sectors that are facing these unrelenting pressures across every part of the UK and Ireland, and where we're trying to deliver fundamental shifts in how people interact with services in ways that demand new levels of cooperation across sector boundaries, that feels like a context where this programme could not be more kind of critical or timely. So I want to start by making sure we celebrate the collaboration that allowed us to develop this resource within the health sector with free open access where that's sufficient, and additional support from NHS Elect, meaning that where paid for input is needed, the expertise and resource is kept and built within the sector. As Q moves into providing commission services alongside activities and resources that will continue to provide free for members. You'll also see more from us in terms of creative ways to support the sector, offering good value options for organisations that share learning and benefits out to the community. I have no doubt that there will be opportunities to collaborate with our colleagues and friends at NHS Elect as we do so. So, as we learn about this programme today, I'm sure we'll be mostly focused on what the specific resources can, do for us in the work that we're each delivering. I can't wait to get into it. But let's also just reflect on what this represents and draw kind of energy and hope from that. I think we need to recognise the skills, the generosity, the public sector spirit from the many, many people who have made this possible. So, thank you. I'm going to pass over to Rob now to share more.
Brilliant, lovely. Thank you, Penny, for that intro. Let me share my screen. Let's start getting into the what it is. Hopefully you're going to see my screen. Let me just do. It's going slow. There we go. We're off and running. So, as Penny said, echoing everything Penny said, this has been a lovely process of working with loads of people, generously giving their time and energy to pull this together. So massive thanks. And of course, massive thanks to Health Foundation Q community for supporting this and helping us get it off the ground. So what we're going to do is we're going to do a bit of an overview, and I'm going to be joined by some colleagues. So I'm Rob Davis, Director with NHS Elect, and I've been with NHS Elect for 15 years or so, and it was just lovely to bring together lots of colleagues from across the quality improvement world and design this programme. I'll let Jenny and Sid introduce themselves as we get to them. We're going to just divide this first bit. And then what we're going to do is go in through what is CQIP. I'm going to talk us through that. Why do we need it? I'm going to hand over to Jenny. How is this programme different? Sid's going to talk us through that. Then we're going to go off into some breakout rooms for some short taster sessions. We wanted to give you a sample of some of the newer things. Some of it might be familiar, but some of the newer things that you might be less familiar with. Then we're going to look at what's available, a bit of a dive into some of the supporting materials. There's an amazing workbook that accompanies this and a programme delivery guide and mural templates, and Sid's going to show us those things. And then at the end, we'll just say how you can access all these resources. And as we said, we're recording this and we'll absolutely share everything afterwards. So we've got a few Slidos. We're going to use Slido a few times the course of the session just to get your views. If you're not familiar with Slido, do not panic. The easiest way to access it is with your mobile phone. So if you've got a mobile phone handy, open the camera on your phone and hover over that QR code, the black and white box thing in the corner. It should come up with a little link and it will let you into Slido. If that's not playing ball for whatever reason, Google Slido, go to slido.com, and our hashtag for today is Collaborative QI. So where are we all? I'm a 7. I'm off the scale on this because I'm so excited to finally get here and be launching this and sharing everything with you. Oh, look at that. If you're at the lower end, hopefully we can give you a nice hour or two with us and give you some energy and inspire and enthuse you for the rest of your day. Oh, look, we're a happy bunch. That's fantastic. Give us a few seconds as we go. I've got another Slido question now, just to gauge who we've got with us, what your experience is with CQIP, Collaborative Quality Improvement Practitioner. Because I can see some very familiar faces and names, which is lovely, and some new people that I'm less familiar with, so welcome as well. So let's just see, what have we got? What is your experience with CQIP today? Is this the first time you've ever heard anything about it? Did you come to some of our co-design events? We did some in-person co-design events in Leeds and London. Were you there? Oh, lots of first timers. Fantastic. Have you been on one of our pilots? Brilliant. Brilliant, brilliant, brilliant. It's great that we are reaching some new people. Would be really interested what you make of it all. A few of our editors are here. Fantastic. Thank you. And as I said, it's just been wonderful working with so many great people in the quality improvement world that have given up their time and energy and effort to bring all this together, which is just lovely. All right, great stuff. Thank you for that. Let's get into it. So what is Quality Improvement Practitioner Programme? Well, first, it's a free to use QI capability building program. So it's a 4-day program aimed to equip health and care staff to lead quality improvement, to do that quality improvement work, make it happen really. And it brings together the learning we had from QI, from quality improvement, but adding in those new dimensions or newer dimensions of taking on a systems thinking lens, which seems so important, as Penny described, the way healthcare systems are changing and developing, and that need to work across boundaries is really there. So adding in that systems thinking element, and also this concept of relational change, the relationships, how we work together. And I've always said, I've said it for many, many years, good quality improvement happens when you get the right people together in the room, having the right conversations. And what we've designed here is a program that really helps that happen. We've created a free downloadable product. You're going to hear the word free quite a lot. It genuinely is free. You can download it, you can use it, and you can go away and implement it. And it was co-designed and created by a vast improvement community across the UK and Ireland, probably over 150 people, plus all the people who piloted it and inputted, and 100 different organizations have contributed to this work. So a massive, massive thank you to everyone who has helped and commented and been part of it. It really has created a product that's different to any individual would have designed. It's created something I think much better than any of us individually could have done, and really shows that power of collaboration. It has taken 2 years, so collaboration does take a while. So this is what it is. And we will be sharing all of these or telling you how you can get your hands on all of these. So it's 4 days worth of content. So 4 full slide decks with facilitator notes. And we're going to show you some of those in the taster sessions. Also, a program delivery guide. So if you're going to be delivering this, that's how to run it, the logistics, set things up, how to facilitate the exercises, whole host of tools and templates to support the group work that goes on throughout this, and a big delegate workbook with everything in for delegates to work their way through and capture their learning journey and their QI work that they're doing. So really nice set of resources that we're going to explore over the course of our time together today. Key thing has also been made to be adapted, because we know one size doesn't fit all. So it can absolutely be delivered face-to-face, and we piloted it in a face-to-face environment. We're also piloting it and have piloted it with virtual delivery, delivering it online on Teams, using mural boards, etc. And also that blended. So it's been designed all the way through to be delivered in that variety of ways that we now find ourselves having to work. We've tested it in a broad variety of settings across both the UK and Ireland, providers, community organisations, across ICBs, and we've tailored it all the way along, and we've really learned from that as we've gone. And we want you to change it. We want you to change it to suit your local context. That might be the worked examples that are there, or your different models, or your different bits that need to go in there. It's designed to allow you to do that. There's some clear guidelines in the guide there about what we think you should really keep in as core content to keep the spirit of the collaborative quality improvement practitioner. It pushes at some of those boundaries. There's a risk always with this, as you take out all the new bits and go back to what you had before, and that kind of brings you back to where you started. So by all means, please do change it, and we want you to do that, but think about that core content. As Penny said, our sort of inspiration for this was the Quality Coach Development Programme, and just really wanted to say where it sat in that sort of dosing pyramid. So here's a really simple view of that QI capability in organizations and systems, and no presentation is ever complete without a pyramid model. This is our one for today. And so you can see QI fundamentals, that awareness across the organization, everyone having a bit of an understanding of QI at the bottom there. Quality coach, those people there to support individuals doing and navigating QI work. And within the quality Collaborative QI Practitioner Programme, this programme sits in that middle, that knowledge and skills needed to lead improvement work collaboratively and focusing on systems thinking, relational change, and of course, quality improvement. So lots in there. Ooh, there's even a reference for that. So we set out with the aim, and these have been refined over time as we've gone through the program, but really to support individuals and teams to develop the skills and knowledge required to successfully improve across boundaries. And that across boundaries bit is really key. We're finding ourselves having to work across bigger and bigger parts of health and social care across ICB footprints with our neighbours, with our colleagues, but also just in our organisations. We can improve our little bit of our system, but we need to work with other teams, other departments. So real focus on that collaborative improvement across boundaries. We set ourselves, and we've tweaked these as we've gone. These are the learning outcomes for the programme. So you can see them there. You're applying quality improvement systems thinking to drive improvement, bringing together diverse stakeholders, using data, supporting scale and spread, and also allowing practitioners to reflect on their experience in leading change, thinking what works, what doesn't work, and the additional challenges of working across boundaries and systems. So all this is in the book, so I'm aware I'm going quite quickly, especially if you are new to this, but it's all in the program leaders guides. And it really has been a true co-design. It really is 2 years in the making, and any of you who have been involved in co-design know it's incredibly worthwhile. You get fantastic stuff out of it, but the process can be a little bit painful, if that's the right word, but you can see it takes a while to get it right. So massively grateful to Q Exchange back in July in 2024, where we were successful with that bid. The original program name was Systems QI Practitioner Programme. That got changed following our consultations and work to Collaborative Improvement Practitioner Programme. There was a lot of discussion over the title, but you can see our timeline, editorial groups. We worked closely with the Open University to really help us refine the learning design approach, to get the outcomes right and how we could do that. That was a really worthwhile experience, and that's infiltrated a lot of what we've done. So massive thanks to the Open University expertise, who really are the leading light in designing learning, and especially online and digital learning. They're doing some great stuff. Our co-design groups have been absolutely fantastic, really pouring their hearts into it and their knowledge and their energy as they designed it. You can imagine when we started this, we had draft content that would have filled probably a 20-day program. And the challenge always with designing programs is there's loads that can go in. It's distilling it down to the really key things. Sid's going to talk us through some of those decisions when we get into the detail. Thank you. Big shout out to London North West. Our first pilot, Emily's with us today. Very brave going first on anything. And so thank you for letting us do that and have a play with London North West people. And if you want to hear from Emily, she's going to be talking a bit about some of the bits of the programme in one of our breakout rooms. We've had loads of pilots, and of course we've adopted a real QI approach to this and lots of iteration as we have gone through. Which brings us to our launch today, and it's very, very nearly finalised. It's not quite there. There was slides still pinging across at 2 o'clock this morning. So it is always last minute, as always these things are. So that gives you hopefully a bit of context of where we've come from on this. I'm going to shut up and hand over to Sid. Sid, why did we... No, I'm not. I'm going to hand over to Jenny.
No, you're not. You're handing over to the other ginger.
Come on in.
Apologies. Thanks, Rob. So for those of you who don't know me, my name is Jenny Guest. I lead the quality improvement team in Oxford University Hospitals, and I've worked supporting improvement probably for the last 15 years of my NHS career. And I guess when we approached this, I think there was a very genuine question about why do we need this? Why are we reviewing something that we know that a lot of individual organisations or national programmes have previously visited, and what's this purpose of revisiting it? But what we do know, Rob, if you flick on, that would be helpful, thank you. What we do know is that despite our best efforts and how much energy we put into it, that change is tricky, that actually the proportion of quality improvement that works is lower than that which people put effort into. And so there was a real opportunity as we stepped into this space to ask the question of why, and to think about what about our own practices or our own kind of prejudices of what we teach or how we teach it might both challenge how people are able to embed this within their day-to-day, but also challenge our own thinking around whether there's further learning that we need to make. What we had as feedback from others as part of the co-design sessions was that, if you flick on, thank you, Rob, was that actually they experienced that QI can sometimes feel that it's isolated, that we're trying to fix things, but not considering it in the wider breadth and context which we deliver healthcare in. And as a result, it can mean that there's unintended consequences, or the ripple effect of that improvement can be minimised by the kind of reduction of engagement that potentially happens when we isolate and think about things within one department or one team or one service. We recognise that for many people, they felt that QI work is not always aligned to the priorities of organisations for very good reason. There was a massive, I've worked in improvement for the last 15 years, and when I first started, a lot of it was driven by the passion and interest of where people were focused and the reality of their day-to-day. What we know is that there's a tension around how do we, yes, support people growing in their own areas of interest, but also support how QI can kind of enable us to move forward on priorities that actually are strategically and leadership driven within our trust. That feels even more precious and important in current context and conversations I'm having locally in my own organisation, but also with other colleagues that I talk and link with nationally. We recognise that actually silo working is inherent often within healthcare, that we get used to the piece that we are focused on, whether that's delivering patient care or whether that's thinking about improvement. And that can mean that we're less inclined to collaborate. And there's a number of reasons for that. I work in an incredibly rich research organisation that means that people feel a complete passion about the development of new knowledge, but the consequence of that sometimes is that we want that sense of protection over that development, whereas quality improvement is about changing and shifting that and really opening up our eyes and our opportunities to broaden our thinking and collaborate with others. People also shared that they had previously completed training where there had been a really strong emphasis on learning theory and technical knowledge around change and around tools. But the reality of applying those in the context and complexity of services and improvement that they were doing was less simple than potentially the tool initially implied. And I think I can definitely relate to that in my own context. So just to go into, okay, what's what's a little bit changed then? How's the why informed what's involved in the programme? So if you flick to the next slide, please, Rob. Brilliant. What we recognise within change, and we often talk about this when we teach, is that 80% of change is not about the technical knowledge. It's actually about the adaptive human element of change. That we can change a process, but unless we bring people with us, actually people will find alternate workarounds unless they believe in it often, or unless the systems support them to adopt that into their day-to-day. So what I would reflect on my career working in improvement was that the minority of practitioner programmes I had been involved with or even developed at different points focused primarily on that technical knowledge, that ability for people to understand the science around improvement. I think what we've challenged ourselves with colleagues on is really to think about how can the Collaborative QI Practitioner Programme really focus on the balance between those adaptive team dimensional elements of change in partnership with the knowledge around the technicalities of improving and using the science of improvement. What we think that we've got is a balance. And actually that's lived out in some of the feedback that we're getting through the pilots that we've hosted. I know we've hosted a pilot across Bob ICS earlier in the year. And a number of people we specifically invited to come on that cohort who had completed practitioner programme in another context previously, so that we had that understanding or comparative. And actually a number of those colleagues have really reflected that this helped them to take theory, but actually make it real. That actually the element of how do I get other people to understand this, not just me to understand it, felt much more relevant and connected than it has done previously, which was an encouraging reflection that's been shared. And what we've also been successful at seeing is the impact that some of those projects coming out of the programmes are starting to make, with tangible improvement in reduction in time that patients spend in certain services where where there's no value added by waiting, or actually reduction in how kind of wasted elements of processes are reduced. One team that I was talking to last week have reduced some of their kind of paper processes by 80% in the last 4 months as part of their kind of applying the principles that they've learned over the programme. So we feel it's got to an encouraging place, and we're excited to share with you actually how is it different, what does look different about this in terms of content. So I'm going to hand over to Sid just to talk through the practicalities of what's included and what's not.
Fantastic. Thank you very much, Jenny and Rob, and thank you, Penny, for the introduction just earlier on. So good morning, everyone. I'm Sid Beach. I'm one of the team at NHS Elect, and been very fortunate to be part of the group of folk who have created this fantastic programme. It is an absolutely brilliant resource, and I really hope that you all use it. I just want to explain how this programme is different than perhaps to those other programmes that Jenny had just referenced. So, there are in many organisations existing QI practitioner programmes or something like that. We are already equipping our staff in quality improvement. So why do we need this programme, and maybe why should we introduce this programme and of course adapt it instead of doing what we already do? So Rob, do you want to move us on to the next slide? And really we just want to really reinforce what has already been said. This programme builds on, collectively many years of learning across the UK and Ireland on what makes quality improvement work. So we aren't forgetting the most kind of crucial ingredient to succeeding in quality improvement, which is, of course, there's really powerful methods like the PDSA cycle, Plan, Do, Study, Act cycle. We've absolutely still emphasised that throughout the programme, but we're also complementing that with systems thinking. So we're really taking some really key concepts around systems thinking in a really practical way and a really applied way, so that we can start to think about what does our system actually look like? How do we understand our system? How do we use that to inform our improvements? So challenging our mental models, our mindsets, our values and beliefs that sometimes get in the way of solving the problem are really powerful. So throughout the whole programme, we've woven through systems thinking, and in fact in the taster sessions in just a moment's time in the breakout rooms, you're going to hear from colleagues talking through what does systems thinking mean for quality improvement and how do we link that in with relational change, and that's that final bit of what makes this program so fantastic is that emphasis on those relationships. As Rob said, improvement happens when people have conversations, when they trust each other, when there's psychological safety, as Johanna had put in the chat just a moment ago. It's so important to focus on that. So right from the offset, we start thinking about those relationships. We start thinking about the people that we need to work with in order to make meaningful change. And that can be quite confronting, because actually what we talk about in the program is recognizing our own blind spots and recognizing the things that we simply don't know. I'm more than happy, when I'm doing my own improvement work, to admit that sometimes I'm wrong. My colleagues Rob and Jenny may disagree with me on that, but I do like to admit that I'm wrong. And also I'm happy to say I don't have the answer to everything. I need to collaborate with people to be able to make those meaningful changes. And this whole program was created in the spirit of these 3 principles of quality improvement, systems thinking, and relational change. And that then led on to the creation of the structure of the program. So thank you to every single person who's joined the editorial board, the co-design groups, the consultation groups that we've ran over the many months and years preceding today. This is the culmination of your hard work. The 5 stages of collaborative quality improvement. This is almost like the journey a practitioner follows when they join the program. Now, of course, we appreciate improvement is not linear, but this program helps to bring some structure to improvement in a really meaningful way, recognizing that before we even start having ideas for improvement or really understanding the problem, we need to create those conditions. We need to really focus our efforts on the relational element, the human element, the stakeholders. And that moves us then, after we've started to really build and focus our energies on our relationships, understanding different perspectives, understanding our systems, using really powerful and evidence-based tools like the SEEPS tool used in patient safety, and how we've kind of woven that in with a quality improvement lens. And then that finally leads on to what might feel more like conventional quality improvement. So stage 3 is where tools like the Smarty AIM comes in, the driver diagrams come in, measurement for improvement is woven throughout but makes a strong appearance in stage 3. So this is where perhaps those of you who teach QI, or there's a couple of hundred of us on the call, all of us I'm sure have been taught QI in some way, shape or form, you'll recognize a lot of the common principles in stage 3 and 4, which is when we start talking about experimenting and testing. And then finally and importantly, continuous improvement and spread. So Jenny referenced silos, Penny referenced silos earlier in this presentation. We can be quite siloed in our thinking. That's not by intention. It's just how health and care has evolved over time and has been set up. And it's difficult for us to sometimes break through those silos and to look up and out of our services, but we need to do that. We don't want to keep reinventing the wheel. If someone finds a fantastic idea, a fantastic solution to falls prevention, let's spread those fantastic ideas, but also continuously adapt and iterate them in the principle of continuous improvement. So these 5 stages are the foundation of the whole program, and the content is aligned to these. When you look at the program delivery guide and the workbook, they both reference this quite comprehensively. And we've had quite a lot of intense discussions and debates as editors and co-designers in the creation of this program, and I've really valued these conversations that have really challenged our thinking. I've absolutely changed my mind a lot in this whole co-design experience, which has been really powerful for me, but also more importantly for the program and for the product that we're sharing with you all today. Because actually what has happened is we've recognized that although some tools can be really helpful in improvement, like fishbone diagrams and the 5 whys tool that I'm sure many of you are familiar with, they can sometimes get in the way of us finding those opportunities to collaborate with stakeholders. They can sometimes lead to, as it says on the slide, a slightly overly simplistic understanding of the system and of the problem. And ultimately, because we don't have that understanding of the system, we then identify solutions that are probably not sustainable, particularly in the longer term. So we've actually said goodbye to some of our favorites, some good friends of ours that we've all got to know and love over the last years that we've taught and led quality improvement work. But that doesn't mean that we haven't learned a lot from them and we've not iterated and improved upon them. So on the following slide, We've got a few highlights of some newer content. Some of this, I'm sure, very familiar to some of you, but for many, this will be brand new. These were brand new to me in teaching quality improvement for the last decade. So we've said hello to relational coordination, and in the breakout room, in the tasters in a moment, Alistair, Nottridge and I are going to talk through relational coordination and then a complementary tool called SEEPs to help us really understand the relationships and the system that we're operating within. A really powerful method from the evidence base created by Jody Gittel-Hoffer, who works in the United States. On the right-hand side, the iceberg of systems thinking, really powerful structure that helps practitioners to challenge assumptions. This is a really popular tool and method that we have heard from the pilot sites and from the delegates of the pilot sites. People really welcomed those challenging discussions with their colleagues using this structure to facilitate that conversation. But thinking then about how do we take forward these fantastic ideas that these practitioners are working up based on their learning from those stakeholders and the relationships and their understanding of the system. Well, EAST is an acronym that stands for easy, attractive, social and timely, and that comes from some work from central government, from the behavioural insights team, who have recognised that this structure can be really helpful in spreading change, making your change ideas easy, attractive, social and timely. Again, a really popular tool for delegates on the programme, one of the highlights for many people. And then TRIZ. This was a suggestion by Bridget, who you will meet in the breakout rooms if you go into the stakeholder conversation in a moment. But TRIZ is a really lovely, liberating structure that kind of challenges your thinking, and almost it can be quite provocative and confronting in a way, but we use it to get people to think about what are they not doing, what's getting in the way of them sustaining change. And again, a really popular tool to round off the whole programme and to reflect on our approaches to improvement in the longer term. Thank you, Rob. Now you'll notice we haven't said anything about a methodology. So in the 5 stages of improvement, there is no particular reference to, for example, the model for improvement, which I know many organizations use to structure and support quality improvement locally, and perhaps it features in your training that you might deliver or that you might have received where you work. Similarly, Lean or Lean Six Sigma is another popular and powerful tool used to support quality improvement in many organizations in health and care. Now, we have decided not to include either of these methods or any other specific quality improvement methodology in the programme, simply because it's not needed. The 5 stages act as a really useful structure that guides people through their improvement work. And we've seen it with the many hundreds of delegates that have been on those pilot sites, and they overwhelmingly have found those stages to be really useful in structuring and helping them with their improvement. Now, that all being said, that doesn't mean that you can't add in your own methodology. I suspect many of you, or all of you will, and we encourage that. We want you to make this product and this program work for you. We want you to add your personality, your context, your culture, the way you deliver your case studies. We want this to be as useful for you as possible. So please change the content. Please make it your own, and that might mean that you add in, for example, the model for improvement where you think that is most powerful, or your own methodology. So that is a really quick introduction to the Collaborative Quality Improvement Practitioner Programme, or CQIP as we call it. Hopefully you've got a flavour for what it is, but we wanted to give you an even more detailed insight into what the content looks like. And so we thought it would be useful to host breakout rooms on 3 different topics that we love from the programme. And these are newer topics. So for some of you, as Robert said, these are familiar things. For many of you, these will probably be quite new slides. And hopefully you can see I'm sharing a slide that says welcome back. And I'm just going to talk you through now a few key insights about everything we've spoken about so far, just to kind of round things off really. Why use this program? You've joined today because you're curious about CQIP, Collaborative Quality Improvement Practitioner. You maybe are thinking about adopting this and adapting this to deliver a cohort or a program local to you, or perhaps you're thinking about using this within your system. I know a few of you are. So maybe you're starting to kind of think about this, but not fully committed yet. Why should you use this? Well, we've got lots of reasons. Here are a few. of the benefits to you, your organization, in using this program. There is much more on this in the program delivery guide. We talk about the benefits to the organization, to the team, to the patients, and so on. Absolutely go and read that. It's really powerful. For now, I'm just going to kind of have a few key highlights. It's a fresh approach. It's something that reflects the current challenges, the current context of health and care as it exists today. So we've almost updated the program, bringing in those concepts of systems thinking and relational change that we feel very strongly about. And we're seeing huge impacts and the benefits of that, as Jenny made reference to earlier. Importantly, cannot emphasize this enough, the program is completely free. There are no strings attached. You will be able to download all of the resources for you to use and make your own. So that includes the slides for all 4 days, as well as a short welcome session. It also includes a delegate workbook that's about 110 pages with all the tools and templates and explainers in there. It's a fantastic read. And of course, the program delivery guide to help people who might be using this resource. So people like myself who might pick this up and then deliver this within an organization or something like that. Completely free. It's proven. We've tested this and piloted this many times, more than 10 pilots of this program with great evidence to show that it works. We'll share that more as we continue to promote this program in the coming months. We'll also share testimonials from people, so it's not just us saying how brilliant this program is. This resource has been professionally crafted, so we're really lucky to have collaborated with Studio Quercus, who are a small organisation based in the southwest of England, who have created these fantastic slides, lovely visuals, and made this look like a really polished product. They're the same team that created the Quality Coach Development Programme that many of you know and love, and they're a brilliant collaborator of ours, and we're really thankful for them in helping us to create this product. The program is very practical, it's action oriented, so it helps people to apply their learning and to do quality improvement. And we give teams tools. You will have seen those in the taster sessions. And we believe this is setting and raising the benchmark for quality improvement practitioner training. We want to make sure we are delivering the best training we can deliver. We're equipping our health and care colleagues as much as we can to improve and to lead meaningful improvement collaboratively wherever they work. And we hope that we're setting this benchmark across the UK and Ireland and possibly even further afield. Now, we've got lots of fantastic resources. We're going to share a QR code in just a moment's time that will allow you to get access to these. So more on that in a moment. But for now, all we've done is just taken some screenshots to show you what these resources look like. These are just 4 of the pages from the delegate workbook of, like I said, I think there's about 110. So you can see there's some really lovely structures here. There's the problem statement structure in the middle. There's the iceberg for systems thinking to get people to challenge their assumptions and mental models. Smarty aims, they're smarty because we're thinking about health equity and inequalities and being inclusive. A really important golden thread throughout the program are health inequalities. So this is just a really brief insight into the delegate workbook. You will be able to get your hands on this and to scroll through this digitally very, very soon. We'll share the QR code for you to get access to that. As well as that, program delivery guide, that's like the second complementary resource. This is for folk who are delivering the program. This is a really good read. It's in 4 different parts. Part A is almost like the exec summary. It's almost the explainer of the program. Why this program? What are the benefits? When should we do it? How do we kind of do it at a strategic level? Part B is the kind of practical, how do we do this as maybe program leaders, the folk who might be responsible for delivering quality improvement training. Part C is a real detailed facilitation guide. So let's say you are delivering day 2 of this program, the systems thinking stuff, the relational coordination stuff, etc. It helps you to do that. It gives you all you need in order to deliver the program. Of course, the slides come with slide notes as well, so everything works together to help you take this off the shelf and use it and make it your own. There is also part D, which includes the evaluation guide to support you to make meaningful evaluations, to gain really hopefully good perspectives and insights into how you're delivering the program and how it can be continuously improved. So the workbook and the program delivery guide, both really useful documents. We also have a mural page. So we've created an online template. The workbook has templates for every single tool and activity so that you can absolutely print those or give those to delegates digitally and they can complete them however they wish to do so. But we've thought it would be really helpful to also create an online platform. So this is on Mural, and you can download this as a PDF or you can create a Mural account and use this resource. And it again has all of the different tools and templates for the program. So here is a snapshot of just stages 1 and 2 of the program. Of course, it's a 5-stage program, and the way we deliver this program is we unhide sections bit by bit and ask participants to complete it. So it will be very small for you to see, but here we have a section on problem statements, stakeholder mapping, stakeholder personas, the fixed, not fixed, gap analysis, who's missing, a kind of challenge on equity and health inequalities, forming a team, I'm losing my breath here, the relational coordination tool, SEEPs analysis, the iceberg of systems thinking, and data. There's so much on this fantastic platform. And again, this is completely free for you to use. So please, please use it, make it your own, make the most of it. Rob, are you back? Shall I hand over to you for the next
I
bits?
am back. I am. Yeah. Do you want to, yeah, just if we keep with your screen. So where we are with the resources, as Sid said, so the workbook and the program guide or the delivery guide is all there. The slide sets aren't quite there yet. They're still just being tweaked with the designers. But if you want to get access to them, if you fill in this form, and I think I posted the link in the chat. If it's the wrong form, let me know. And we will get them out as soon as we're ready, and you'll have the full slide set or the link to download the full size sets and the book and things. So please do register. What we're doing is we're just asking for your email addresses and things, just so we can maybe get back in touch with you if you agree and just see how it's going. Are you using it? Any feedback, any comments and stuff? So we want to try and build that community of practice for people that are working with this to keep in touch, keep supporting each other. Because what we've learned with Quality Coach, after a while, actually then needs tweaking and developing and things. So we want to try and keep our community of practice around this together, but it is completely free for you to have access to. So please do fill out that form either via the QR code or the link, and we'll make sure that gets shared when we share the resources from this session. So as I said, so the PDFs of the workbook for delegates and how to run the sessions is ready to go, and they really are beautifully designed, so we can get those out to you. The full slide sets in PowerPoint aren't quite there yet, but hopefully maybe Monday, it's optimistic, but middle of next week we'll absolutely have those ready to go and share them, and you can use them. And as Sid said, lots of times, you know, make them your own, adapt and change them to fit what you need. If you want to know a bit more, at NHS Select, we are offering a train the trainer approach for this. So if you're interested in delivering this as a trainer, and there is some new stuff there, if you want to know how we do it and Sid and the team deliver this, register for this. I think I've got a QR code coming up on how to do that, and we'll get the link in the chat. So those are the dates of the workshops. Now, the good news, if you're an NHS Select member, we might be able to get you that in your existing contract, or if not, we just need to charge for that just to try and cover our costs, really. So we're not able to offer the train a bit free, sadly, but we're doing that as the cheapest possible cost we can. And if there's several of you who want to come from an organisation, let us know, and we are very happy to come up with a sort of arrangement that suits us all, make a bit of a deal on that for multiple places and things. So if you're an NHS Select member, you might be able to get it through your existing membership. No guarantee on that, depends who your account holder is. And if you're not, you're most welcome to come along, and we've got those dates there. You don't need to do train the trainer to use it. This is just a helpful offer if it's helpful. If you're good to go with it, just take it, absolutely use it. So this is a sort of add-on. We know when we did Quality Coach, this is pretty hugely popular for getting people established to do this. So that's a quick deep dive in some of the newer materials that you might not be familiar with, support to set it up as well. Sid, anything to add on the train the trainer piece?
Just to really re-emphasize, to say you will get support from us, that kind of dedicated support from one of the kind of editors who created this program to help you to make a plan to actually deliver this. So this is, again, in the spirit of practitioner, this is an applied train the trainer. We're kind of really gearing you up to deliver this, and try and see if you can do it through your membership wherever possible. That is our preference.
Brilliant. Thank you. So as soon as we have the resources, we will get them out to you. And yeah, an absolute massive thank you to everyone. There's lots of great friendly faces on this call who have been a really key part of sharing their expertise and their knowledge to make this program a reality. It really is an amazing piece of co-design. So thank you everyone who's tested it and commented. And the journey doesn't stop now, so please do take it on, test it, evaluate it, let us know what you're finding and thinking. And big thanks to Penny and the Q community team as well. Yeah, have we got time? I don't know that we've got time for too many questions and things. Sid, Bridget, Jenny, any sort of final comments? Emily, Ian, Jenny, come on in.
Yeah, I guess I was just going to reflect that I know that we are sharing it as a 4-day kind of practitioner course, but I know that other pilots have tested it in a slightly different configuration. So one of the things that we will share for people is the options that the pilots have used. So for instance, across the Thames Valley kind of Bob ICS pilot, we actually did it over 5 days, which provided space in the sessions for people to kind of do the work with the people in the room, just because we had the luxury of being able to stick to 5 days, having previously done practitioner that way. So I think we will be sharing different models, because this is very much about you adapting it to make it work for you. I think I've definitely been delivering training previously where it's been really emphasised not to change the slide decks that you're given, but that is absolutely not the case in this context. I think we found that, you know, the content was brilliant, but we wanted to give more space and time, and that worked for our services and for across our kind of, you know, partner organisations within the ICS. So I guess I just wanted to highlight that we really do mean it when people say we want you to adapt it.
We do. Yeah, absolutely. And we also want to hear from you. So perhaps as you adapt it, you're going to create your own case studies. And perhaps if you're working in the ambulance service, it'd be nice to have a case study to share with colleagues across ambulance trusts in the UK and Ireland, so that they can do something similar themselves. We don't want to reinvent the wheel. So we're going to be a bit like a sponge and absorb as much as we can from you. And we'll absolutely put that on a platform for others then to be able to access. So please do share, do keep in touch as you use the resources, and I'm sure we'll see a lot of you at the Train the Trainer or other events that we run to showcase this program and to accelerate it and to encourage spread across the whole country.
Brilliant. Thank you. Sorry, Katie. I was going to say thank you and have a great rest of the day and the week. Over to Katie.
Brilliant. Thank you so much to all the speakers. It's been so brilliant hearing more about the Collaborative QI Practitioner Programme. It's been such an informative session. Thank you.